Welcome to the webinar, Healthcare 102, Clinical Quality Improvement and What is Public Health's Role in Adolescent and Young Adult Healthcare. Really glad to have you here today. This is a webinar and a learning opportunity through the Creating Youth-Centered Care learning community for state maternal child health professionals, sponsored by the Adolescent and Young Adult Health National Resource Center, which is a partnership between the Universities of California, San Francisco, Vermont, Minnesota, and the Association of Maternal Child Health Programs. And if you're interested in learning more about us and what we can offer to you, there is our website at the bottom of the screen. So we're really excited to have you here today to talk about clinical quality improvement and what role that plays in making health care better for adolescents and young adults, and what public health role is in that. We're being joined today by McCain Scharf, who is our presenter. She's filling in last minute for Wendy, who was our original presenter who had an emergency. So thank you, McCain. McCain and Wendy put their heads together and shared ideas. And so, again, thank you to Wendy, too, for her insights for this session. McCain comes to us to share her extensive experience managing quality improvement efforts. She's served as a quality improvement coach and program manager for the School-Based Health Improvement Project in New Mexico. This was one of 10 CHIPR demonstration grants, which was a project that was a collaborative effort between Colorado and New Mexico. And they worked with 22 school-based health centers to improve quality of care for adolescents in these states. Following this, the program manager for Envision New Mexico in their school-based health quality improvement initiative. She integrated lessons learned from this grant into the ongoing QI efforts in school-based health centers. Through this, McCain infused her quality improvement work as a strong advocate for the school-based health center model, serving as a board member and advocacy chair for the New Mexico Alliance for School-Based Health Care. McCain currently consults nationally on youth-focused quality improvement for the Adolescent and Young Adult Health National Resource Center. She earned her master's degree in health policy from Georgetown University in 2012 and is currently a PhD student focusing on adolescent health in the Population, Family, and Reproductive Health Program at Johns Hopkins Bloomberg School of Public Health. So welcome, McCain. Thanks for being with us today and sharing your insights.
Hi, can everybody hear me?
Yes. Definitely.
Great. I will be talking today about clinical QI, and the areas that we're going to cover together are QI rationale, QI process, public health role in QI. I think we're hearing a little bit of feedback, so if you haven't muted yourself, if you could do that, that would be great. So moving right along, starting with rationale. And I will stop at between each section and have a chance for folks to answer questions, ask questions, and share ideas. If you have questions, feel free to chat. Oh, we'll start hearing somebody. If you haven't muted yourself, you can either do that through your phone or by *6 or pound and then #6 unmutes. Okay, so quality improvement really deals with changing systems. Every system is designed to achieve exactly the results it gets. And so if you want to change something and you want to make improvements, then you really need to understand and change the system within which the work is occurring. And systems, happen at multiple levels. So, the clinical system works within a larger healthcare system, which works within the national system. So really understanding your role or the work that you're doing within the system that it's working within and where you can make changes. So not all systems you have control over, but you often have control over the system you're working within, pieces of that system, and that's where you can make your change to achieve your goal and move the system from your current to your new state of performance. So a couple of underlying QI principles. Quality improvement is really about incremental change.
Yeah, great.
So it's important to establish what your overall goal or aim is, and we'll talk a little bit more about that as we go. But in order to get to that aim, it's going to take smaller cycles and incremental change. And you're going to learn from each of those Hello? Did someone say?
I just feel bad. You know why? We're hearing a lot of back talk. If people could just make sure to mute their line. No, I'm kind of involved because I'm feeling guilty that I probably should have escalated something or tried to.
So can we mute everyone so we don't have this issue?
Yeah, I'm kidding. They're getting all women in other departments.
Sorry, everyone. Just give us a minute to try and resolve this.
To avoid that, you know, like I just feel unnecessary. But
hello, we have somebody that's speaking in the background that I don't believe realizes online. So if you are talking right now,
and that's their point. That's
please mute yourself.
Something they knew about the new and several times on stand. Let's get it done. It's kind of a recurring thing. So it's like, get your shit.
Okay.
No, different one.
Oh,
yeah, different one.
Is it? Can we mute everyone? And because I don't think that the person.
Kristen, can you press star? Kristen, can you press *5 to mute all, please?
Okay.
The leader has muted your line. To unmute your line, press #6.
Okay. Okay, I think you can go forward now. Sorry.
McKenna, you'll have to press #6 to unmute your line right now. Thank you. McCain, I'm sorry. Press *6 right now. I'm sorry, #6. This is great. Excuse me, please. McCain and Kristen, can you hear me? McCain, if you can press #6 right now to unmute your line, that should take care of it. Kristen, can you confirm that you can hear me, please?
Yes, I can. Can you hear me?
Yes, I can. Great, thank you. McCain, if you press #6, it should unmute your individual line.
McCain, why don't you hang up and call back in? I really apologize, everyone. This is not our normal. So hang in there with us. If you've got something to do for the next few minutes, why don't you check emails or however you like to go about things.
Hello?
Hello?
Hi, can you hear me now?
Yes, thank you.
Okay, I called back in and that seemed to work. Pound 6 was not working for me before. So thank you everyone for bearing with us through our technical difficulties. So back to where we were. So quality improvement principles. So as I was saying, it's important to really lay out your aim, but you are going to have incremental changes to get to that aim, and it's going to take small cycles, and there are going to be times when things don't work, and you're going to learn from that and change and redirect. Quality improvement is always data-driven, so you need to know whether the strategy that you've implemented has made a difference, and in order to do that, you need to collect data and be able to see if there was a change from baseline. It's really about shared learning, so it takes a team working together, communicating, learning from each other, and this means, not only within the team where you're doing the quality improvement, but beyond. So opportunities to share what has worked in similar settings or not worked, so others can learn from that. Quality improvement happens within systems and requires processes, so it's important to understand those before and as you take on quality improvement work. And which system you're working within will determine if it's an individual or a population health outcome that you're trying to impact, and ideally you can have impact on multiple levels. And also we want quality improvement to be sustainable, so that means that the strategies that you implement should be ones that can be sustained beyond the life of the PDSA cycle, but also whatever systems you have in place to do quality improvement needs to be sustainable, so that that's something that's ongoing. It's never you do one quality improvement project and everything's better and it will be better forever. You need to be able to sustain that quality improvement and continuously look at your care and look at areas where you might be able to improve. So why do people do quality improvement? So of course the most obvious and important one is to improve the systems and the care that we provide, and within the context of this webinar, that's specifically for adolescents and young adults. And that's really, really important. We want to always be improving the care that we're providing and making sure that we're meeting the needs of the patients that we serve. There are also often national or state quality improvement initiatives that you might get involved in, and so being a part of that is another one of those initiatives is another motivation. Providers, doctors have to do maintenance of certification, so there might be quality improvement projects as part of that process that providers participate in. Same for medical home certification. Some certification programs require continuous quality improvement as part of the certification process. The pay-for-performance models that are becoming more popular, often, if you're paying for high performance, you want to make sure that the care that you're providing is high quality, and quality improvement can help you get there. And then also there may be funding and reporting requirements that require you to be doing continuous quality improvement, or in order to meet reporting requirements and showing that you're making improvements in a specific area, you may want to do quality improvement to help you to meet those requirements. And then some quality improvement guidance and support that can be helpful for those who decide to undertake quality improvement, especially if it's something new for your organization or your practice. So using established, and that should say QI models or processes. So there's a lot of tools out there already, models that have been used for a long time that can be really helpful, and there are some links to some of those resources later in the webinar. Utilizing a QI coach either internally within your organization or externally, someone that you hire or receives outside funding to support the quality improvement work that you're doing. So I have served as a QI coach before, mostly with school-based health centers. it's really nice to have, important to have a QI champion, and we'll talk about this a little bit more when we talk about your team to do quality improvement. But having somebody that really is driving, organizing, and keeping people on task is important. And then leadership support is really important, and I think this is linked with the dedicated time, which is the next piece. So it's important if you're going to undertake quality improvement work that whoever is deciding what the priorities are of the organization supports this work and make sure that there's dedicated time to do quality improvement efforts, because it takes time. You know, you really have to look at what you're doing currently, think about how you want to change and how you'll change, and then take the time to collect the data, look at the data, and continue the process until you hopefully reach your aim. So a couple of areas of QI that might be relevant for the populations that we're thinking about in this webinar, so adolescents and young adults. So on the clinical side, well visits, of course, making sure they're coming in for their regular preventive well visit checkup. It's an opportunity to kind of assess both strengths and risks and make appropriate referrals or provide anticipatory guidance to adolescents and young adults. And then another area would be immunizations. There are some immunizations that are specific to adolescents, are really important to get during that time period. So that's another area, clinical area that you might focus your quality improvement efforts on, and we'll talk specifically about one example with HPV a little bit later. Obesity and overweight as another clinical area. You know, as adolescents are starting to have more control over what they're eating, their activity levels, it's an opportunity to really engage with them and set some goals that they can really have an impact on and instill knowledge and practices that will carry with them into adulthood. Sexual health, so STIs, safe sex practices, reproductive health, these are all areas that are important for adolescents and young adults and can be the focus of your clinical QI. And then behavioral health and mental health issues such as depression and anxiety, screening, assessment, follow-up, treatment. So those are just some examples of clinical QI areas, all of which we dealt with within our SHIP project. So happy to share about any of those if folks have questions specific to any of those clinical QI areas. And then thinking about the system, so within your clinic or more broadly within a broader healthcare system. So things that are really important for adolescents and young adults are ensuring privacy and confidentiality, so time alone with the provider where parents aren't in the room to ask questions or discuss potentially sensitive topics, and also confidentiality, so ensuring that when students or when youth have the ability to consent to their own care, that the care they're providing is provided in a confidential way, and there are a lot of systems that need to be put into place to ensure that. Ensuring that the places where care is provided is youth-friendly, so it's welcoming to youth. There are things that they care about. They're on the walls. There are brochures that are relevant for them. The people that they interact with when they walk in the door are youth-friendly. That'll make a big difference for whether, kind of set the tone for their whole visit. And then, of course, having providers that are aware of adolescent, young adult clinical topics, but also, willing and able to talk to youth in a way that is respectful and ensures those privacy, confidentiality pieces that we were talking about. The importance of having youth engagement and including that within the work that you're doing. So having a youth advisory board for your clinic or, your organization that helps define maybe what quality improvement you do because they see an area of need. Ensuring accessibility, so making sure that your space where you provide care is somewhere where they can get to if they don't have a car, or if they can't, don't have a parent to drive them, or accessible after school hours or within a school if it's a school-based health center. The importance of communication, I think this goes back to the confidentiality piece very much, but knowing, making sure that youth know how to contact and communicate with the clinic or provider, and also ensuring that when the communication comes from the clinic or the provider back to the adolescent, that it's done in a confidential manner, in a way that they feel comfortable with. And that may be in ways that the healthcare system doesn't traditionally communicate with its patients. And then health literacy, I think this is kind of combined with the last one, but goes beyond, and ensuring that we're building the health literacy skills with our young adults, our adolescents and young adults, that will ensure that they continue to interact with the healthcare system when they need care, and for preventive visits, during their time of adolescence and young adults, and as they move on through their lives. So just a quick example from New Mexico, and then I'll open up for questions for this section. As Kristen said at the beginning, I worked with school-based health centers doing quality improvement in New Mexico. And in New Mexico, school-based health centers, the majority of them are funded by the Department of Health. And along with that funding comes a requirement to each year focus on 2 youth-relevant quality improvement areas. And what the Department of Health does is they contract with Envision New Mexico, where I used to work, to provide quality improvement support to school-based health centers. And so this is an example of how kind of the motivation piece, not only are school-based health centers wanting to provide good care for the youth that they serve, but it is a requirement of their funding. But along with that, the Department of Health recognizes that there may be a need for additional support around quality improvement, and so they've contracted with Envision New Mexico for a number of years to provide that additional support. And just an example from that, kind of building off of this a little bit more in terms of what quality improvement looks like within the larger healthcare system. So I would say the majority, and that's continuing to be the trend in New Mexico, of school-based health centers are funded by federally qualified healthcare systems, and they, what we as coaches would often do is encourage them to align their required school-based health center quality improvement with existing quality improvement work within the larger system. So, for example, they have UDS reporting requirements that are specific to their, tied to their federal funding. So if there are ways that they can do things through their quality improvement, for example, if they chose to work on a clinical quality improvement area of obesity and overweight, it would allow them to improve their BMI screening, which is one of their reporting requirements for UDS and for their federal funding. So understanding that quality improvement is part of what they should be doing as part of the healthcare system, and then there are many ways in which their work can benefit, multiple requirements. And, I think the fact that there are multiple requirements for quality improvement show that it's a trend within the healthcare system to really be wanting quality care, in ensuring our triple aim. So I'm going to pause here. I don't think we've had any questions come through the chat box, but if anybody wants to unmute themselves, I believe that's #6, or type into the chat box. I'm happy to pause and answer any questions, or if you have examples that you want to share from your experience, we'd be happy to hear them as well. And it is #6 to unmute, theoretically anyways. Okay, well, it doesn't look like we have any questions, so I'm going to, so did you conduct a youth-friendly clinic assessment using teens? We did not in our work with school-based health centers. However, some of the COIN work that is ongoing right now through the National Resource Center's work has used several different assessments that look at kind of the youth friendliness of a clinic from the teen's perspective. So Michigan has an assessment tool that some of the clinics in the project have used. Others have developed their own assessment process, and often, and both of those include a piece where youth go into the clinic and kind of do their own assessment. I think that's really important. You know, I think any of us could go into a clinic and think that something is youth-friendly, but the only people that can tell us if it's actually youth-friendly are the youth themselves. And it can be a great way to kind of, and we have used it within the COIN network as kind of a starting place for areas where a clinic may want to work, identify an area of improvement based on that assessment. So there's something that the youth are seeing within their assessment that could be improved from their perspective, and then the clinic chooses one of those areas to do their quality improvement project on, and then we are collecting data through actually asking the teens themselves about their visits, and are using that data to kind of inform and the quality improvement work and see if there's been improvements in those areas. And we'll talk about the importance of data in the next section. Okay, I'm going to move on to our next section, but please, if questions come up as I go, please feel free to type them in. So the process, so I'm going to kind of quickly go through the basic QI process. I know many of you have experience with quality improvement, and hopefully some of this will sound familiar. And if I'm going too fast, please stop me, and if you have specific questions about any of the areas. So one of the common models of quality improvement is the model for improvement, which is what we used in New Mexico in our work. And it has kind of three main pieces. So the first question, which is really important, is what are you trying to accomplish? So that's your aim. So really defining what you're trying to accomplish. And then the next question is, how will you know that the change you make is an improvement? Not all change is an improvement. It's important to know whether what you've changed is actually improving and working towards the goal that you've set. So that requires measurement and data. And then what changes can you make that will result in improvement? So that's kind of really thinking through what you're going to do within your system to make changes that are going to produce the improvement that we will see when we measure and use data to see whether we've worked towards our aim. And then down at the bottom is that, in that circle, is the plan, do, study, act cycle. So, you know, you have an overall aim, but it will, as I said, it's an incremental change. So you're going to do a number of plan, do, study, act, or PDSA cycles to help you move towards that and to understand if the strategies that you've put into place are actually working towards and making the improvements that you're hoping it would. So we'll talk a little bit through kind of what each of these pieces are: plan, do, study, act. And then again, there's a link to some resources that kind of some tools that can help you through this process. So here are the QI steps. First is assemble, and we'll go through each of these. Assemble a change team, develop an aim statement, which is your desired outcome, develop a roadmap for change, determine your measurement strategy, identify your strategies, and then implement and test your strategies. So you do 5 things before you even start to implement and test your strategies. So it's not like, oh, we're going to make a change, let's go for it. There's a lot of pieces and steps that you need to undertake before you can jump in and start doing the work. So the first one is to assemble a change team. So really, this is a really important step. It's important to make sure that your team includes people that are involved in all areas of the system and kind of understand what needs to happen in order to make a change. So, and understanding that no one person, although it's important to have a champion, and a champion is an important part of the team, no one person can solve a problem on their own. So it's important to get buy-in from everybody who who needs to make their own changes for there to be an improvement, and who may have insight into how changes will be improvements or what will be an improvement. So an effective team is flexible, willing to change and respond to the ongoing and unexpected. So I think quality improvement is always fun and exciting, and I mean that very positively in that, you know, things happen. You plan something out and you measure to see if there's been a change, and something unexpected happens, and things, you know, you have to totally switch or shift your direction or try something that you didn't think that would ever be a strategy that would work, and that requires a team to be flexible, and also to be creative and solution oriented. So, you know, that's why it's so important to get buy-in from the beginning, to understand that you're all working towards the same goal, and that you can kind of be flexible and creative in order to get there, and understand that there's not just one path, or that the path that you think is going to work, it may not, and you have to be willing to go with the flow a little. So then the second step is to create an aim statement once you have your team, and you want your aim statement to be SMART, so specific, measurable, attainable, relevant, and time-based. Be really clear about what you want to accomplish, so you're picturing kind of what the end result will look like. And so we have an example of a couple of aim statements here, and you'll see how they're SMART. So making sure that they're really specific, that they're measurable, so the data piece comes in. We'll talk about that a little bit more. You know, you really want to be clear. So by a certain date, so this HPV vaccine says by October 2016, decreased missed opportunities for administering the HPV vaccine to eligible adolescents, and then specify the age 11 to 17, by 20% over practice baseline. So this necessitates that you've measured your baseline rate, that you're going to continue to measure, so you can see if there's been a 20% improvement, that you know what your population is, that it's adolescents 11 to 17, and that you want to meet that goal by October 2016. Time alone is another example here of an aim statement. I'll let you read through it, but again, it has those components of making sure that it's a SMART, that it's really specific to the goal that you're trying to achieve. And then once you've set your goal and you're clear about what that goal is, your whole team is on board for it, you need to develop a change roadmap. So an idea of how you think, what improvements you think need to happen in order to achieve the outcomes that you've set for yourselves. So a couple of tools are a logic model to really spell out, like, if this happens, then we think this is going to happen, and so where we need to make the change in order to have the result that we want. Key driver diagram, I'll show an example of that next. And this kind of roadmap helps you to understand the system, its outcomes, so that's kind of the end of your model, or and the processes that drive those outcomes. So each of the pieces within the map that help you get to where you want to go. So here is an example of a key driver diagram, and I don't expect you to be able to read this, but just to kind of see, so you can see that there's a goal, which is to improve youth-centered care for adolescent patients and families. So it's a broad goal, but then the aim is much more specific. So it's specifically around time alone. And as we saw on the aim statement, it also had like by a specific percentage. And then you have the key drivers. So what are the important pieces in making sure that you're going to get to your aim? And this one kind of works, whereas a logic model often works left to right, this one is kind of right to left. So we're saying that the strategies and interventions over here on the right-hand side are what is going to impact these key drivers, and these key drivers together are then going to influence our overall project aim. So really spelling those out and understanding who's important, who the key people are to make each of the changes happen, so that your overall aim can be reached. And there's some links at the end to some more examples such as this one. So your fourth step is to determine your measurement. So here, this is where data comes in, and data is so important to the quality improvement process. Again, you can make a change, but you have no way to know if it's improvement unless you're measuring. And that means that you have to have a baseline measurement, and then you have to measure again after you've made your changes to understand if anything has improved. It's really important to use short cycles, because if you implement this whole thing and nothing has changed, if you've done it for 6 months, then you're going to be really disappointed at the end of the 6 months. It's important to kind of collect just enough data to understand if there's been an improvement, but not so much that it's overwhelming or that it's onerous to collect the data. To understand that you're collecting the data for learning versus accountability. So there are places where data is used for accountability, but quality improvement in the PDSA cycle is not one of those. It's just to help us understand what is happening. And, you know, the next point is failure is good. If something happens and we don't see a change, or we see something decrease when we wanted it to increase, then we know that that doesn't work and we have to try something else. But we wouldn't have known that, and we learn along the way. You know, a lot often, so the PDSA form that we use has an area for unexpected results or circumstances. So you're documenting what happened that you weren't expecting, and then how do you amend for your next PDSA cycle. The importance of quick turnaround of the data, so ensuring that the data is easy to collect. You can quickly put it in some sort of data collection or reporting system that you have in place, and then get back the results. So I think there's a movement for a lot of that to now be electronic. You're putting in data, you're getting back reports. Ideally, that's happening kind of in real time, so that your short cycles are informed by data that is being collected as you go. And we'll see an example of run charts in a minute. Run charts just allow you to view data over time and to see trends or increases, decreases, and it's a really nice way to visualize your data. So here's an example from, and I borrowed this from Wendy, so thank you, Wendy. This is a monthly data report from the National Immunization Project that NIPIN did in collaboration with APHA. And you can see, you know, it's less important to see kind of the bits and pieces, but really you can see that these data are displayed visually. We know that it's getting, you know, because they're monthly reports, that they're happening on a monthly basis. And there's multiple data points. So we see the first box is the total missed opportunities for HPV vaccine. The second is a reason for that the youth was not vaccinated, and then the third is the percent of charts with an intervention. So we're not just collecting one piece of data, but multiple data points that can help inform what's going on and why we're seeing the changes that we are or not. And then this also shows, which is nice, is shows the practice in blue versus the aggregate in red. So you can see that in both cases, the first and the last chart, the practice is following the general trend of the aggregate. But if you saw that, you know, something is really different than the aggregate, you might wonder what's happening at this clinic that's different. And, you know, if it's really below what the aggregate is, what are all the other clinics doing that we might be able to do, and how can we learn from others' experience? And then finally, it's because it's a run chart, every one is a month. So, you know, this is a pre-test or baseline, and then each month we get data and we're able to see the trends. So this is great. Total missed opportunities are going down, percent of charts with some sort of intervention to improve. HPV vaccination rates are increasing, and then the reasons, you know, that the person declined, this green line is not documented. So we're seeing that the reasons are being documented, even if the ultimate declining reason is that for not getting vaccinated is declined. At least we know that. Before we didn't, you know, when we started here, we didn't know because the majority of them were not documented, and if we don't know why, we can't do anything to change that. Okay, so step 5, develop strategies. So this is where you actually start thinking about what you're going to do. So you've got your team together, you've figured out what your aim is, you've decided how, you know, how you think change is going to happen. you've figured out how you're going to measure change. Now you want to develop strategies to make the changes. So you want to make sure you have strategies that are clear in terms of the population that you're going to target. It's really important to assess readiness to change, so there are tools for that in terms of assessing a clinic, a staff readiness to change, a population's readiness to change, and you really want to make sure that there's some sort of readiness and some opportunity there to make a change. And then understanding the current system is really important. So again, there are tools for this to understand the current system. So a process flow map that helps you really map out, like, how is it currently happening? Where are the points where we might be able to intervene and make a change? And then based on your understanding of that, choose a strategy based on best practices. So if something hasn't worked before, why not try it in your setting? And really making sure that it's a doable strategy. So if you come up with a strategy that's super intricate and, you know, involves 10 different people doing 10 different things, then your chances of those 10 people doing everything all at once are pretty low. So you want to kind of pick those doable pieces and understand as each of the pieces work and kind of build from there. And then finally, this is where you actually do something. So step 6, you implement your strategy. And again, we're using the model for improvement. We're using our PDSA cycles. So we've planned that whole, you know, steps 1 through 5 is our planning. Then we finally do it. We use our measurement strategy that we've defined to study. So we compare our data that we're collecting now to what we collected at baseline, and then decide, do we want to continue to do what we've been doing? Is this working? Do we want to implement it further in different sites? Do we need to amend something? So RA that we were using at Envision is amend, act, amend, or abandon. So act, great, it's working, let's keep on doing it. Do we need to amend something? Is it sort of working, but we're running into these snags here or there? Do we need to amend something and try it again? Or do we need to abandon? This is not working, and that's okay. Failure is okay. And now we know that this is not going to work. We need to implement a different strategy and start all over. And again, once you've done all of the planning, the next PDSA cycle is going to be a lot easier because you've already established your team, you've already done all of those planning pieces. It's just what your strategy is changing a little bit. So you're able to quickly implement a new cycle, study it, and then make a decision about what to do. So a couple of key things to remember before implementing change widely is to test changes on a small scale. So that might be with a specific population if within your clinic, or if you're part of a bigger system within one clinic, to remeasure, to analyze impact. So, you know, you might make a change and the first month everything looks great, but you have no way of knowing if that's just an anomaly. So you need to continue to collect data and understand if this is an ongoing trend that you're seeing as you continue to implement that change. Pilot results over time. Make sure that things continue to work in different settings, and implement and spread the change once you figure out that it's something that works. And understanding that because it works in one setting doesn't mean it's going to work in another setting. So you need to test it out in that setting again, and then go through the process. So the next piece is about public health role, but before I jump into that, I want to know if anybody has any questions specifically about the quality improvement process, the steps it takes. It looks like we've had a little bit of conversation on the chat, some good conversation about sharing practices. Any other questions about the quality improvement process or examples from your own experience? And remember, it's #6 to unmute yourself, or you're always welcome to use the chat box. Just make sure you're sending it to all attendees. Okay, so either I've put you all to sleep or you don't have any questions. So we'll move on to the next piece, which is public health role. So it was fun for me.
Were you able to?
Oh,
Oh, hi. I was muted. I'm sorry. I'm not on WebEx because I can't access it, so I'm just taking notes. But so, okay. I wondered if you could, I missed step number 3. So I've gotten all my notes, except can you tell me what step number 3 was?
Sure. So that's to develop your change roadmap. So understanding how you're going to make your change or how you need to make changes to get to your outcome. And there was an example of the key driver diagram. And I'm sure we can email you the slides afterwards if you'd like.
Yes, I will ask for it if it doesn't come out. So
okay, great.
Thank you.
Sure. Any other questions? Okay, so public health role, and like as I was saying, it was exciting for me to think about this because I've moved out of the on-the-ground implementation of quality improvement into the public health world, education world, and thinking kind of big picture now. So what's public health's role in quality improvement? And so support, partner, and provide tools and data are the things that I came up with. So I know many of you are working on the state level and maybe not necessarily in clinics on a day-to-day basis, but you often will work or support clinics. So what can you do in your role, in your public health role to support quality improvement, especially for adolescents and young adults? So if you have the opportunity, you can make quality improvement a requirement or a priority. So that might be through your funding or whatever requirements you put on the clinics you work with or the systems or organizations that you work with. Or you make a priority through, the sorts of opportunities you offer or the trainings you offer or what you talk about when you go out to visit sites. And share success stories. So if you know that there is a clinic within your state that has really taken on a quality improvement project and made an exciting improvement or had a really great experience or involved youth in a really exciting way. So there was conversation about involving youth in the clinic assessment, and Wendy shared about how their Youth Health Advisory Council members were conducting the clinical assessments on site and providing the feedback. So that's a great way to kind of share things that have worked well. And this can happen through a variety of, in a variety of ways. You might have a learning collaborative to bring folks together. We found so often we did do a learning collaborative through our shift work, and we could go out as coaches and share this information, but it was so much more meaningful and valuable when it came from peers. So as much as I know people are really busy, especially if they're working at the clinic level, but if you can offer opportunities for people to share their experiences on the ground and what has worked or what hasn't worked, that can be really valuable. We all have our feelings about technology, and we experience some of our own challenges today, but there are really great opportunities that come along with our new technology in terms of sharing in ways where we don't have to be in the same room to share and learn from each other. And then I think when you have the opportunities to talk to leadership or people who are decision makers or setting priorities for the clinics that you work with or specific within systems or health plans, if you can get buy-in from them and help them to understand the importance of quality improvement, that's so important in the process and especially in the sustainability of quality improvement. And then again, if you're able to link QI efforts with other projects or initiatives, so if your state has a specific health topic that they're really pushing at the moment, and you see that there's a quality improvement opportunity to not only meet that kind of state level goal within the area, but also to implement quality improvement within that, and to learn from others who may have implemented a similar project in other areas. That's a great way to support and promote quality improvement in adolescent and young adult health. And then bringing partners together, and we talked a little bit about this in terms of learning collaboratives and the COIN, which is kind of our way to electronically connect. But there are also a lot of QI organizations within our states that you can connect with. Like I said, the Department of Health in New Mexico funded Envision New Mexico, which is a quality improvement organization to support school-based health centers to do quality improvement work. And there's already a network of these sorts of organizations across states that do this work, and that's the National Improvement Partnership Network, or NIPIN, and there's a link to that in the slides. We have some representatives from that organization on the call today, but you can check them out. You can see what the partner organizations are, and whether there's one in your state that you could contact and see if they're willing to provide some support or guidance for folks that may be working on quality improvement or wanting to get involved in quality improvement and don't know where to start. Funding is always great too for those partners. And then you want to, there's an opportunity when there's our opportunities to provide training or resources specifically about adolescent and young adult health. That's always a great way to kind of integrate, to share best practices, and then say, and you can do a quality improvement project to ensure that you're meeting best practices in these areas, and it gives folks the pathway to kind of get to and reach what we're hoping is going to be really high quality care. And you can even provide training or resources around quality improvement and partner with one of the organizations in your state. And then, bring together those who have interests and skills in adolescent and young adult health, and that in itself is going to create opportunities to improve quality, because folks are going to share what's working and what's not working, what they've done, and ideas about how that can be transferred. So we're already having that happen here on our chat box, where Heidi is asking for the youth-friendly clinic assessment, and Wendy and Diane are happy to share what they've done in their states. And I think so, just getting people together that are interested in adolescent and young adult health is going to lead to quality improvement. And then, as I said, you can always provide QI tools and data tools that are already available, and then opportunities to use data. So there's a couple of links within the slides to the Institute for Healthcare Improvement, IHI, which has some, they've been doing this work for a long time, and they have some great tools. HRSA also has some tools. So they, kind of a place to start. They have some of the basics, some of the tools that we talked about in terms of key driver diagrams or process flow maps, logic models, those sorts of things, kind of as a starting place, or some templates to get your work started. And then, we live in the world of data, and we collect data all the time. So think about especially on the state level, if you're already collecting data, and then how might you be able to use that data to inform some sort of quality improvement. And I think the first piece of that is to make sure that the data that you're collecting goes back to those who need it, and ideally to those people who entered the data, so that they understand that they're not just entering these numbers into some big black box, but this data is being aggregated or used in such a way that, for a reason, and then that can be shared back to them, even if it, if that wasn't the original reason for collecting the data, if it's for some sort of reporting requirement, you can share the data back to them and say, here, this is what it's looking like at your clinic. Here are some areas for, and then they're able to see where they might be able to make some improvements, and then continue to see the data and to inform their quality improvement and whether they are actually making the improvements they're hoping to make. And I think a key piece of that is when you're sharing data back to folks is to make sure that it's presented in a way that's understandable. I think we can, some of us can look at an Excel spreadsheet and understand all the numbers and what they all mean, but there are a lot of folks that kind of just becomes overwhelming, and it just looks like a bunch of numbers. So we saw an example from the HPV immunization project about how data might be able to be presented in graphs in such a way that you could look at that and understand what the trend is, even if you don't know the exact numbers. So just a quick example from New Mexico, and then we'll have a couple minutes for questions. So as I said, there's a school-based health center quality improvement requirement in New Mexico, and Department of Health partnered with APEX, which is a community organization, to help create a data warehouse. And because that data was being collected electronically, we were able to partner with them and just say, hey, let's use this data to inform quality improvement, and kind of moving towards a fully electronic system in order to do reporting, to identify QI areas, to use the data that's already available, to establish a baseline, and then to continue to see what the progress is throughout the school year. And then New Mexico, 2 resources available through Envision New Mexico. There are links on the slides. One is the Adolescent Health Initiative. Within the handouts for today, there's also a flyer about that. So the Department of Health provided some funding to University of New Mexico and Envision New Mexico in particular as part of their, because they're under the Adolescent Health Division, to do some training specific to adolescent health issues. So that in the fall there was a series around primary care, physical health, and this spring there's one focused on behavioral and mental health issues. All of those videos, webinar recordings are available on the Envision New Mexico website. You can look at what's been done, sign up for ones that have yet to be held, and great way to kind of understand some adolescent health initiatives in a way that in New Mexico, different organizations have partnered to support high quality care. And then there's also a link to some QI tools, including our PDSA form that I mentioned. So I know we're pretty low on time, and sorry I didn't leave more time for questions, but I'm happy to stay on. If folks have questions, you can press #6 for the phone, or you're welcome to type in questions in the chat box. And while we do that, this is my email address, mccain.scharf@gmail.com. Feel free to reach out to me if you have questions not answered here or about specific things we talked about. And then I just wanted to highlight that the next 2 upcoming webinars, the one on April 10th is an example of quality improvement in action, so healthcare in Ohio, the Transforming Adolescent Care Learning Collaborative, or TALK. So we'll have that coming up next, and then state partnerships for quality healthcare on April 20th. So 2 more webinars upcoming that involve quality and quality improvement.
Well, McCain, this is Kristen Teipel. I wanted to say thank you, and I want to thank everyone else for being on today. But thank you to McCain for filling in so well, so last minute, and providing us with your wealth of resources and information. As is always, please join us with future webinars on healthcare in adolescents and young adults. We appreciate you being with us today. Thanks, and have a great afternoon.